Hello, my well-being buddies. It's Steve, the mental health nurse, and we're going to look at now emotionally unstable personality disorder. So we're going to cover here what is emotionally unstable personality disorder, some of the common causes, look at some of those risk factors, some of the signs, how it's assessed, some of the treatments, and some of the medication that may be prescribed. So first of all, what is emotionally unstable personality disorder? It's one of the borderline personality disorder families of diagnoses. And basically, it's where our personality is what it says, unstable. So it looks at how our values, our history, our upbringing, and everything that creates us creates our personality. And we're kind of assessed on a social norm there. So how do people operate? How do most people think and feel? And how do I think and feel? And is that in the same ballpark? So as we go through this, personality disorders can cause a wide range of symptoms, and they're normally put into four groups. They are emotionally unstable. So the psychological term is affective dysregulation. They can have disturbed patterns of thinking or cognitive distortions there, or different perceptions. They can have quite impulsive behavior, and they can feel quite intense, but unstable relationships with others. And these areas are quite challenging, quite difficult, and really hard for the person with emotional unstable personality disorder to manage. So being emotionally unstable, looking at that. So if you have borderline personality disorder or emotionally unstable personality disorder, you will probably experience a range of intense negative emotions such as rage, sorrow, shame, panic, terror, a long-term feeling of emptiness and loneliness. And it comes from this really darker place where nothing just seems right. And when I worked with emotionally stable personality disorders in the community, you could always tell straight away, because when you talk to them, the persona is a lot more flat. Seems very little joy, and it takes a fair bit of work to get people into a point of recovery. So they can have severe mood swings in a very short space of time. And it's common for people with EUPD to feel suicidal, that feeling of despair, and then feeling reasonably positive a few hours later. Some people feel better in the morning and the same in the after, and probably worse in the afternoon, or vice versa patterns, just really depending, but very unpredictable in their ways. If you have a diagnosis of EUPD, or you're working with EUPD and they are having suicidal ideation or suicide thinking, it's really important to make sure that you get them the right help. So that could be the referral to the GPs, it could be the emergency services, it could be Samaritans. But hopefully with the diagnosis of EUPD, they are known to secondary services and they should have a crisis plan or crisis interventions in place. So if they don't have a crisis plan, if they haven't got a safety plan, then this is something that we absolutely need to get sorted out straight away, because it's likely that they're going to be leaning on this a lot. If people have been diagnosed with EUPD, tell someone you trust about this, and obviously talk to them about what it is that happens and how you feel. So the disturbed patterns of thinking around EUPD are those upsetting thoughts, such as things that self-saboteur stuff. I'm a terrible person. I'm better off dead. There's no need for me to be here. And again, they can seek reassurance quite a lot. And obviously what they're telling themselves is completely untrue. They may have brief episodes, such as hearing voices outside their head for a minute at a time. These often feel like instructions to harm yourself or others, and you may or may not be certain whether they are real or not. Prolonged episodes of EUPD and borderline personality disorders, again, can have episodes of abnormal experiences, such as hallucinations, voices and visuals. And again, can have some really distressing beliefs that they feel that there's nobody to talk to, and what's the point? And this very much links in to psychosis and being psychotic. And those signs are the fact that they're becoming more unwell, and therefore they're really struggling with delusion. And there could be some paranoia in there as well. The impulsive behavior bit, which is part of that diagnosis, looks at two key areas. So it looks at kind of the impulse to self-harm. So that could be cutting, that could be burning, that could be using cigarettes. In severe cases, they may also feel that intensity, sadness, and depression, and this impulse can lead to that suicidal ideation and attempt of suicide. There's a strong impulse to engage in reckless and irresponsible activities. And then that again could be around binge drinking, that could be around drug misuse, that could be around gambling or unprotected sex with strangers. So again, a fair bit there around impulsive behaviour. The unstable relationship part of EUPD looks at the way that they feel with others. And this could be abandonment, that people abandon you when you need them the most. And again, if people get too close, they can be quite destructive. When people fear abandonment, it can lead to those intense feelings of anxiety and anger. And this can come out in multiple ways. So again, this could be constantly texting or phoning somebody, suddenly calling the person in the middle of the night, clinging on to that person, refusing to let go, or making threats to harm or kill themselves if that person ever leaves them. So again, really quite distressing. Alternatively, you may feel others are controlling or you're feeling overcrowded. You may feel that you're being provoked. So there's this intense anger and fear that comes alongside it. So it's really important to be mindful of all of that. And again, this can be things such as emotional withdrawing, rejecting people, and verbal abuse. The two patterns may result in unstable love-hate relationships with certain people, so very on, very off. Many people with emotionally unstable personality disorders seems to be stuck in a very rigid black and white view of the relationship. Either the relationship is perfect and the person is wonderful, or the relationship is doomed and this person is terrible. People with EUPD seem unable or unwilling to accept any sort of grey area in their personal life. So very fixed ideology. So for many people with EUPD, personal relationships, including relationships with professionals and carers, involve go away, please, don't go away. And it's that state of mind. And I've worked with a lot of people in the past where you get accused of being the same, or you build that therapeutic relationship. And when it's time to end that therapeutic relationship, it feels like all of the work that you've done becomes undone around this whole, you're just like everyone else, you're now leaving me. So what can cause borderline personality disorders and emotionally unstable personality disorder? Well, genetics is one of them. Genetics you inherit from your parents, and it can make you more vulnerable from developing borderline personality disorders and emotionally unstable personality disorders. A study found that if one identical twin had borderline personality disorder, there was a 2 in 3 chance that the other identical twin would also have borderline personality disorder. However, the results have to be treated with caution as there's no real evidence around genes. It's a problem with the brain chemical. So it's thought that many people with emotional unstable personality disorders have something wrong with the neurotransmitters in their brain, particularly around serotonin. Neurotransmitters are the messages that's the chemicals used in your brain to transmit signals between brain cells. And altered levels of serotonin could be linked to depression, aggression, and again, around controlling and destructive urges. The problem with the brain development, so research has shown that the use of MRSA studies with people with emotional personality disorders, that MRI scans show a strong magnetic field and radio waves produced in the image of the bodies. So the scans reveal that people with PD and EUPD, 3 parts of the brain are either smaller than expected than usual, or have activities where things were picked up. So again, in the hippocampus, you could see on these scans, there were different things. So again, the amygdala, where you've got, it plays a part for emotionals, feelings and fears. So again, at the front, the hippocampus, which helps regulate behavior and control. And the orbital frontal cortex, I don't think I've probably said that right, but it's something like that, which is involved in the planning and decision making. So if the amygdala, the hippocampus, and the orbital cortex, frontal cortex, sorry, have these irregularities, then it is to do with the way that the brain is structured. So this isn't a behavioral thing. It's not people being evil and horrible as people say it. And therefore there needs to be a real sympathetic approach. And it's very difficult to help somebody when you feel that what you're doing isn't making any difference. But do bear with it. Do keep on being non-judgmental, keep being compassionate, and keep offering the support that you can. There are environmental factors. Of course, with mental health, a lot of stuff can be environmental around borderline personality disorders. And this can include being a victim of sexual or physical abuse, being exposed to long-term fear as a child, being neglected by one or both parents, or growing up with another family member who has a serious mental health condition, such as bipolar or a drug misuse problem. So again, becomes survival instincts. So how are they diagnosed? Well, ultimately, you would see your doctor if you were concerned about EUPD, and the doctor would rule out other common mental health problems such as depression, etc. What would then happen? The doctor would suggest a referral to your local community mental health team, and that would be the adult treatment services. So you'd be referred there, and they would then do an assessment and a review, and obviously do a diagnosis there. You would probably then be referred on to the community mental health team, and you may end up with a community mental health nurse to support you. But during the assessment, you would need to answer yes to 5 or more of the assessment questions. So the questions that are used for screening come from the DM5 and the ICD-11. And this is where, do you have an intense fear of being left alone, which causes you to act in a way or seem out of the ordinary, so such as phoning somebody, but not included self-harm or suicidal thought? Do you have patterns of intensity and unstable relationships? Do you have a fear that you do not have a strong sense of your own self and you are unclear about your own self-image? Do you engage in impulsive activities in 2 areas that are damaging, such as unsafe sex, drug misuse, reckless spending, but not including self-harm and suicidal behaviour? Have you made repeated suicide threats or attempts in the past, or engaged in self-harming? Do you have severe mood swings, such as feelings of intensities, anxiety and irritability in the last few hours or few days? Do you have a long-term feeling of emptiness and loneliness? Do you have a sudden intense feeling or anger or aggression? Do you find it difficult to control your anger? And when you find yourself in a stressful situation, do you have feelings of paranoia? Do you feel like you are disconnected from the world? So if you could answer yes to 5 of those, then that would be one of the screening tools. It's important to involve your family because, again, they have insight to you and they need to be involved in advanced decisions around managing crisis and risk. So looking then at treatment for this, so now moving down to the treatment, over time, people with emotionally unstable personality disorders overcome their symptoms and recover. Additional treatment recommendations would be advised if it returns. However, the kind of things that we're looking at for non-medical approach first is healthy lifestyle, healthy diet, steering clear of substances, avoid stresses and triggers, Have a good support network around you. Make sure you've got lots of social prescribing going on, keeping yourself busy and active, have purpose and goals. And you then may need additional support around you, part of your community mental health team. So that could be your social workers, your community mental health team, counsellors, psychiatrists, or occupational therapists. Through secondary services, so through your hospital setting, you should have a CPA, and CPA stands for the Care Programme Approach. And that's where you develop your care plan, and that's the assessment, the care plan, any appointments and reviews. You would continue to have reviews with psychotherapy, and additionally, you may be invited to cognitive behaviour therapy or dialect behaviour therapy, which is more appropriate around this risk-taking and these high intense feelings. So dialect behaviour therapy is a therapy specifically designed to treat people with borderline personality disorder. DBT, is based on the idea that two important factors contribute towards borderline personality disorders and emotionally unstable. You are particularly emotionally vulnerable, for example, low periods of stress that makes you extremely anxious, and you grew up in an environment where emotions were dismissed around you. These two factors cause you to fail to navigate your life well. And obviously they cause problems about you managing your feelings. So the goal of DBT is to break those cycles and introduce two important concepts. One is validation, so accepting your emotions are valid, real, and acceptable. And two, it looks at a philosophy that says most things in life are rarely black and white. So it kind of breaks down this thought process, this fixed ideology. And by validating your feelings and by breaking down this thought process, you're able to move forward with your life and be able to kind of break free, as it were. There is MBT therapy as well. There is TCS therapy, there's art therapy, and there's lots of other different types of therapy out there that can be used to treat this. What's important here is having a strong crisis plan. And in a crisis plan, because again, people that have EUPD tend to have strong ideations of self-harm and a risk to suicide. So in that crisis plan, you're going to have your crisis resolution team, you're going to have several phone numbers, you're going to have some advanced decisions, maybe where to go if you're feeling bad. It might be the case that you have picked a hospital where you want to go as a place of safety. And again, you may want to be talking about sections. So a section, you could do the section where you take yourself there. You could do a section, or you could ask for like a section 2 where you're detained under the Mental Health Act. If you're out in the community and you don't feel safe, you can always ring the police and ask them to do a 135, 136 and get you taken to a place of safety. So there's lots of things that can be done to keep you safe whilst you are in a very unstable mood area. Equally, it might be the case that you are going to be prescribed PRN medications as and when required. And that might be things such as a tranquilizer just to calm you down and to help manage this. So looking then at medication that's used, there is a real division here where the medication is helpful. No medication is currently licensed to treat EUPD personality disorders, but NICE guidelines make recommendations around the use of other conditions. So depression, we might be using antidepressants, or we could be using things to help with the anxiety and mood stabilizers, or antipsychotics. And again, they're prescribed to help manage those mood swings and keep you more regulated. So let's just summarize. So EUPD is an emotionally unstable personality disorder caused by trauma, neglect, genetics. Risk factors here is that poor risk-taking behavior, self-harm, overspending, impulsive, and unable to self-regulate. Signs of EUPD: being withdrawn, being down, signs of symptoms, signs of depressed, and those assessment criteria in which we talked about earlier. When I gave you that whole list, you needed to have 5 out of that list. So that's how it's assessed. Natural treatments then: exercise, routine, vitamin Ds, B6, B12s, omega-3s, good sleep hygiene, good routines, good work plans, and a care plan approach. So the CPA approach there. Medication then could be mood stabilizers, antipsychotics, or antidepressants if prescribed by the doctor. Anyway, hopefully that's been helpful. My name's Steve. I'm the mental health nurse, and I hope you found that useful. Take care.